arthritis on that leg, do you have paresthesia, which the Yorubas call paja? The Igbos call it tatangwere. Some people interpret it as kill dog, paja. So if you have all those symptoms, you know that.
Okay, the one that some sort of seizes your movement.
Yes,
Okay.
yes, stiffness and the rest of them. That is alternating both lanes or going up and down. You know that pain is not, arthritis pain is localized in the joints. That pain is not most patients, 90% of my patients are actually low back pain, and the causes varies.
All right. Okay, now this person is Stanley talking from Facebook. He says, any first aid treatment in manual arthritis? I guess we've discussed that now. And then he says, and Dr. Bone, should hospital be the first place to visit? There can be access to home remedy. You've talked about that now.
Yes.
All right. Now let's go to Prince. Prince, probably the wife is pregnant, because he says, can arthritis condition have effect on a pregnant woman?
Yes, because a pregnant woman is going to add close to 10 kg, and even though the baby is 2.5 to 4 maximum for normal children, the woman herself, her body weight will increase by at least 10 kg, and that's extra weight on the weight-bearing joints. So that's why I tell young ladies, especially the ones that are wearing high heel and the rest of them, and they have trauma to the ankle or their knee, or they fell off a commercial motorcycle or Okada. I tell them, please, whatever pain you're having now, please manage it properly, because by the time you get married and you start having big children, by the time you're pregnant, your weight increases and the pain gets worse.
Well, Dr. Bone, we have a caller. Hello there. Hello, are you there? Hello? Hello? Good morning, yes.
Good morning.
Yes, go on. Your name and where you're calling from, question. All right, okay.
Okay, paresthesia in the hand.
Remember older people, that's what you said?
Yes, elderly people is used to, when we go do x-rays, we see the radiologist write spondylosis. Spondylosis is just a big term, just to, which is you literally attribute, describe as arthritis of the neck bone, the cervical bone.
Yes, spondylitis.
Those are the causes. In arthritis of the spine, you start seeing new bones being formed called osteophytes, and they are spiked. And these nerves are coming down from neuroforamen right from the central canal, which is spinal cord, is towards forming the brachial plexus, supplying the hands. So when these smaller bones are there, they impinge on these nerves, and the sensory nerves react by making you feel as if blood is not flowing in your hand, paresthesia, and the rest of them. And that treatment a proper treatment can be given.
Now, I guess you're going to laugh now, because this is from Tunde. Tunde, I think it's on WhatsApp. He's saying, I learned their spiritual process in arthritis management. That's why birds and animals are revered among bone setters. Dr. Bone, is this a fact or myth? Okay. Tunde, did you hear that? I hope you're listening. Do call us on 0906 000 3352. Today, just call so that we can laugh a little bit more, right?
There's something I like to say about knee pain or joint pain in young. In young, usually trauma.
Okay.
And usually soft tissue injury within the joints. So it's not necessarily arthritis. And that is why part of the surgical management, the first line of management, is joint repair. We want to look into the joint and find out what is wrong. Is it a meniscal tear? Is it a cruciate ligament injury like the ones you see in footballers? And that can be repaired and returned back to health through television surgery called arthroscopy. Then in the elderly, when the joint is completely destroyed, we start talking of joint replacement. This is where I come in as an arthroplasty surgeon. Then there are those
that you can replace the joint, really?
Yes, that is joint replacement. Both hip and knees, easily and commonly done. Even shoulder replacement is also easily done. Then there is another group which the joint is completely destroyed, like the ankle where you say the shackle joint. So what we do, we just fuse the joint together, which is arthrodesis. Those are the three categories of surgery. So
when you fuse it, wouldn't that person
fuse it at
have some disparity?
No, we fuse it at 90 degrees. You don't even know. The person can walk properly, but may not be able to do a lot of things like the sportsmen do, sprint, run up and down, and the rest of them.
And that retires a lot of footballers, I guess.
Yes.
Okay, now this is very interesting from Ronald. Ronald is on Facebook. He said, can shea butter play a big role in arthritis management, Dr. Bone?
Yes, what the Yorubas call ori, the Igbo calls it okume. Shea butter is just a soothing. There's no analgesic effect from it. Do you understand? Instead of use shea butter, then you should use an analgesic cream, because
Okay.
all you need to do is apply and let it go, penetrate into the joints.
Okay. Oh, we just lost a caller now, but do call in if you can. Whoever running off, but do call in 0906 000 3352, because almost everybody has arthritis, so we won't look at it.